And welcome to the Basic and Clinical Science Anesthetic course. My name is Andrea Coleman. I work in Uppsala, Sweden, and this time I'll be presenting physics, but not just any physics. It's physics that are important for the European Diploma of Anesthesia. So this is the summary for the lecture today. It includes the SI systems, force, pressure, flow, and tensions, principles like Bernoulli, Venturi, and Coanda. Then we're going to move into the gases and all the gas laws. And finally, a little bit about osmosis and the Wheatstone bridge. So the International System of Units has come in the exam before, and I think it will continue to come. There are two types of units. You have the base units and the derived units. And the typical question is, well, is the time measured in seconds is a base unit? Yes. And distance measured in centimeters? No, because it's in meters. So you have, for time, it's a second. For distance, you have the meter. For amount of substance, it's the mole. For current, it's ampere. For luminosity or luminous intensity, it's candela. For mass, is kilo, and this is a usual one that they like to ask because everybody thinks milligrams or grams. And the unit of thermodynamics is, of course, the Kelvin. Then, in the derived units, there are many derived units, but the ones that are most useful to our knowledge are force, usually measured in newtons, pressure, usually measured in pascals, that we'll see in a moment that it's not only Pascal, energy measured in joules, power in watts, frequency in hertz, and volume is the cubic meter and liter. And this is important for the gas laws. And these are the most important derived units in the field of anesthesia. But of course, there are many more. But if they ask you in the exam, the unit for energy is the watt? Well, no, the unit for energy is the joule. So these are typical questions that can come in part one as part of the true or false. Then we go into force. And force is that which changes the state of rest of motion of an object. Well, that means a push or a pull of an object. And it's described in Newton's second law, which states that force is the mass times the acceleration. This means that it has a magnitude and a direction. And the weight of a body is a measure of the gravitational force exerted upon it. So in everyday life, well, we use the unit of mass in kilos to quote our weight. But if we really want to say weight, is the mass times the gravity. So here in force, we continue with the force equals mass times acceleration. So how heavy is 1 Newton? Well, the force of gravity is 9.81 meters per square second. So therefore, 1 kilogram is 9.81 newtons. And when they are asking you, for example, in part 2, how do you do the cricoid pressure? Well, you need to describe it, where you do it, and then you need to describe that you apply a force, and a force is in newtons, and you apply a force of 30 to 40 newtons. And you can also tell the examiners that this is 3 to 4 kilos, and because force is mass times acceleration. So if the examiner knows that you have not only memorized, 30 to 40 newtons, but can actually understand why or where does it come from, you'll get your 2 points for that question. And since force applied to a perpendicular to the surface area of an object per unit of area, so this one, I have my force perpendicular to my area, that is pressure. And pressure can be measured in many units, but the most typical one is the Pascal. So 1 Pascal is a pressure of 1 Newton in 1 square meter. And from this slide, we saw that 1 kilogram is 10 newtons. So this is about 100 grams of mass. So how much is 1 Pascal? Is 102 grams per square meter. Is this important? Yes, because you'll see in the next slide how it starts making sense. But this formula of the pressure, which is the force in the area explains why a stiletto and women that have walked with stilettos in the garden will feel that it just digs in the ground, because the area is so little, then even if the force, the perpendicular force, is not as big, you have a big amount of pressure. And this is compared, for example, to an elephant, which creates less pressure because the area is much bigger. So we have the pressure equivalence. 1 atmosphere, what we're breathing now, can be measured in different pressure equivalents. It can be 1,325 pascals. But this is very difficult to remember and to use for the normal day. So instead we use kilopascals. So 1 atmosphere is 101 kilopascals, so about 100 kilopascals. But 1 atmosphere is also 1 bar. 1 atmosphere is 760 millimeters of mercury, or 760 torr, or 1,020 centimeters of water, 14.5 pounds per square inch, so PCI. 1 torr, of course, is 1 millimeter of mercury, because these are exactly the same. And 1 kilopascal is 7.5 millimeters of mercury. And why is this important? Because all around Europe, people use different pressure equivalents. For example, before I work in Spain, and we measure the end tidal of CO2 in millimeters of mercury, and now I work in Sweden, and it's measured in kilopascals. So you need to know the conversion units. And in the exam, there are a lot of questions that just give you the information in one unit, and you need to give the answer in another. Then we move into gauge and the absolute pressure. So absolute pressure is the sum of the gauge pressure and the atmospheric pressure. And if you remember, in the anesthesia equipment, we're talking about blood pressure. So blood pressure is the mixture of the gauge, is my blood pressure, plus the atmospheric pressure, and thus we need to zero the transducers. And this is also important in cylinders, because in a full oxygen cylinder filled to the max, the gauge pressure, for example, can be 137, but the absolute pressure is 1 extra, is 1 atmosphere more, and 1 atmosphere equals 1 bar. So this is important to know, that the cylinder has everything that it's shown in the gauge meter plus the atmospheric pressure. Then we're going to move into flow. This lecture is a lot of little concepts joined together. Flow is the quantity of fluid passing a point per unit of time. The fluid can be of 2 types. We can have laminar flow and we can have turbulent flow. And we're going to describe them. So laminar flow moves steadily. Is the flow we like. It's not the one that creates a lot of turbulence, as the turbulent name describes. There are certain characteristics that are marked in red that you need to memorize for the exam, because they have come before. For example, the flow is 2 times as the center here. This is twice the flow than here to the sides. And there is virtually no flow near the edges. The velocity is low, and it is described by the Hagen-Poiseuille equation, in which the flow is the difference in pressure times pi times radius to the 4 divided by 8 length and viscosity. And you see that there is a huge arrow here pointing to the 4, because this is to the 4th of the radius. And this is very, very important, because they can ask these questions in part 1 as a pure basic science, like the Hagen-Poiseuille equation is this, and you need to say true or false. Or in the part 2 examination, the more clinical questions, they can ask you about a massive bleeding, and you need to tell them, yes, I want to put big gauges, so big IV lines, and I want them short, and I want them thick in diameter, because the radius has a big impact, and if the line is longer, So if this increases here, then the flow diminishes. So that's why having a central venous line in a big bleeding is not important at all. You want a 14 to 16 IV line in here. So you can explain it in the part 2. You can tell them, well, I want this because according to the Hagen-Poiseuille equation, I gain this and this benefit compared to using a central line. Then we move into turbulent flow. And this occurs if there is a constriction and the velocity is increased and there is high resistance, and then the flow cannot circulate as nicely, so it becomes turbulent. There is an equation that tells us if the flow will be laminar or it will be turbulent. And it's the Reynolds number. If the Reynolds number is less than 2000, then the flow is laminar. But if it is more than 4000, the flow is turbulent. In the exam, you won't get asked between 2 and 4000. It will be very clear. If the flow is if the Reynolds number is 1000, that indicates that the flow is turbulent. No, it's false. The flow is laminar because Reynolds number is under 2000. And the things that affect the Reynolds number are the velocity. So more velocity, more Reynolds. The characteristic dimension, this is the characteristics of the fluid itself. The density, so higher density, higher Reynolds. And the viscosity, lower viscosity, higher Reynolds. And this one, viscosity, is very, very important because we'll see the clinical application in just a minute. So remember, in the exam, laminar is exactly what we want. It's double the flow at the tip compared to the sides and almost nothing at the edges. And it's ruled by the Hagen-Poiseuille equation that you need to know by heart. And instead, the turbulent flow has a Reynolds number over 4000. There is a specific equation for the turbulent flow, and I have not put in it because it has never come in the exam, and I highly doubt it will. And you're telling me, okay, you've told me about one clinical applications. What other clinical applications are there? Well, we ventilate patients in our anesthesia machine every day. We put tubes in the airway, and tubes have a diameter. So I need to make sure that the flow that I'm putting through my tubes is not too high. Otherwise, the flow will be turbulent. So, for example, there's something called the critical flow of depending on the airway diameter. So for a 8 millimeter tube, the flow becomes turbulent at over 8 liters. And is this really important? Well, yes, if you're doing especially pediatric anesthesia, because then the sizes of the tubes you're using are much smaller, and then you need to reduce your flow accordingly. And then you have helium, because helium mixes are higher in viscosity. So if I increase the viscosity, I lower the Reynolds, and if I lower the Reynolds number, I'm making my flow more laminar. And that's extremely good in patients that have a bronchospasm in which the airways are severely decreased in size. Okay, we're going to move into tension and Laplace. The Laplace law is the one that rules the tension. There is an equation for cylinders and a equation for spheres. You have the pressure is tension divided by the radius, and for spheres is 2 times the tension divided by the radius. And is this important? Yes. Has it come in the exam? Yes. Both cylinders and spheres equations have come. And there are some clinical applications that, for example, as the diameter of the vessel becomes smaller, it wants to collapse. You know, as soon as, you start deflating the lungs in the expiration phase, it really wants to collapse. So that's how atelectasis are born. And it's also what dictates the critical closing pressure in the lungs. So, for example, in newborns that their airways don't have enough surfactant, then when they, at the end of the expiration, the lungs collapse. So that's why by pushing in surfactant, you avoid this collapsing. And that's also why we use, some PEEP to keep the lungs open at the end of expiration. Otherwise, they want to collapse. And another application is if you have an aneurysm, and the radius of the vessel is increased, then it means that the inward force of the vessel is decreased, because the walls become thinner and thinner and thinner and thinner, and then it cannot keep the amount of pressure, and then it just explodes, getting a rupture aneurysm in the brain. We're going to move into the Bernoulli principle, and in fluid dynamics, an incompressible fluid's velocity must increase. So here, the velocity must increase as it passes through a constriction in accordance with the principle of mass continuity. And while its static pressure must decrease in accordance with the principle of conservation of mechanical energy. So there are two principles here. So if I have a constriction, the velocity needs to increase and the pressure decreases. And fluid pressure is inversely proportional to its velocity. Higher velocity, lower pressure. So we're going to just read, everybody, I want you to read what's here in this red box. It states that an increase in the flow velocity of an ideal fluid will be accompanied by a simultaneous reduction in its pressure. This is the perfect description of the Bernoulli principle. And this has come in the exam many, many, many times. That's why I've put it in red so that you can all memorize it. And what are some applications of this? For example, you have the Venturi effect, which is an extension of the Bernoulli principle. The effect by which the introduction of a constriction, so you make it on purpose, the constriction to the fluid flow within a tube, causes the velocity to increase and the pressure to fall. And this reduction in pressure, you can use it to actually put things in the system. You know, you entrain whatever you want, fluid or gases, in the system. And this is exactly how nebulizers, atomizers, this is exactly how they work. You create a constriction, then the pressure drops and you can entrap things into the system. So in the exam, atomizers uses the Venturi effect or the Bernoulli principle for it to work. That is true. Then we're going to move into the Coanda effect. And I challenge you, everybody, I want you to go to the kitchen when you have some moment and put a spoon to a flow of water. If you put, have you seen also, just going back into the flows, have you seen if you open the top a little bit, your flow is very nice and laminar, but if you increase it and increase the velocity, then it becomes turbulent. But that's also an easy way to see the laminar and the turbulent flows. But I want you to go to the kitchen, put a laminar flow, and then put your spoon. And the spoon creates an angle, and the Coanda effect states that the tendency of a fluid to be attracted to a nearby surface. So it just gets attracted to the spoon and you can change the direction of the flow. And you are telling me, but why do I need to know this? Well, because I'll tell you two good applications. In the anesthesia equipment class, I'll be talking also about, you know, the unidirectional valves, when you have your breathing system so that the inspiratory limb and the expiratory limb have valves. Well, previously they have valves. Now they rely on the Coanda effect to have the different angles. So if the air is coming this way, when you have the patient expiring, it will follow a certain angle, and by modifying these angles using the Coanda effect, you have exactly the same effect as unidirectional valves. And another one is if your patient in the airway has a lot of mucus plugs, then they can alter the flow into the lungs. And even if there is an opening in one of the bronchi, I'm not saying that it needs to be a total, you know, a total closing won't work. But if you have still a partial opening but a mucus plug, then because of the Coanda effect, the flow will move in different, it will behave in different ways. And you can actually do, and I have read about a case that they created a uni-lung ventilation when the tube was perfectly placed above the carina. So the tube was perfectly placed, but there was a mucus plug, and that created, without the total blockage of that lung, an uni-lung ventilation. So applications are mucus plug that can cause maldistribution of the gases in the lungs. the atherosclerotic plaques that can cause unequal flow in the vascular tree, and you can get a stroke. And they replace in the white tubes. I know it's a lot, but we still have all the gas classes to go, and I hope that in the exam you're not looking like this guy when you get your answers, but in fact you remember this lecture and can answer all of them. So we're going to move into the gas laws. So the gas laws are different laws that you need to know and memorize because they come in the exam, but I will give you the special memorizing trick at the end that will help you answer the questions a little easier. We start with Boyle's law. Boyle's law states that for a given mass, this is my gas, my mass, at a constant temperature, here is my temperature that remains constant at 300, the pressure times the volume is a constant. So if I do the multiplication of pressure 1 times volume 4, it will give me 4. And here, pressure 1.3 times volumes 3, it will still give me 4. So Boyle's law is that for a given mass, at a constant temperature, the pressure times the volume is a constant. And the application you're asking, well, it's easy. It's to know how many liters are in something. So because the pressure times the volume equals the pressure times the volume. So for example, this can be my gauge pressure of the cylinder. So how many bars of oxygen are in the cylinder. This is the capacity of the cylinder in liters. And this is the atmospheric pressure. And this is the actual amount of gas in the cylinder. So we'll do this multiplication. If I have 137 bars and my cylinder is a little one of 3 liters, the atmospheric pressure is 1 bar. How many liters there are? Well, there are 411 liters in the cylinder. And I know you're asking, but why do I need to know this? I'll tell you a practical example. One colleague of mine was doing colonoscopies in a private hospital. And then the technician arrived and said, Doctor, I'm sorry, there is a problem with the pipeline supply. So this is what we have for today. And she got a cylinder of oxygen. And well, she did the multiplication and she knew exactly how many liters of oxygen she had for the coming 10 patients, and then how many hours she needed to apply oxygen. So she knew if it will last and how much flow she could administer to her patients. So it's a very, very practical application. Then it's also good to know the cylinder content. And in the anesthetic equipment class, we talk about N2O and CO2, that they are liquefied under pressure. So, for example, I have my oxygen cylinders. If they are filled to 100%, well, you have the gauge that marks that they are filled. If you remove a bit, well, the gauge marks that they have left. If you remove a bit more, the gauge marks that you have even less. And then when there is nothing left, except of course the atmospheric pressure, then it marks 0. But this does not happen with N2O and CO2 because they're liquefied under pressure. So their content is measured by weighing them. So you have your cylinder of N2O to the max, and the gauge measures that it's full to the max. But then you remove some, but immediately the liquid moves into gas. And it's totally saturated with pressure from that gas liquid going to gas. So the gauge will still mark that it's full. And then you remove some, and the same phenomenon happens. And the gauge marks that it's still full. And then you remove everything, and suddenly it's 0. So in the exam, if they ask you, how do you measure the gas contents, or can you measure the gas content using the gauge manometer with a CO2 cylinder? The answer is false. You need to weigh them. Okay, we're going to go into Charles' law. Charles' law states that for a given mass, I have my mass, at a constant pressure. So the pressure here, if you see in the image, it's 1 and 1. The volume is directly proportional to the temperature. So more temperature, more volume. less temperature, less volume. It's directly proportional. And some applications are that, gas expands when heated. So I heat this and I get more volume. So gases expand when heated and they become less dense and thus they can rise. That's convection. And air close to the body surface gets warmer and moves up. And this is important when we're discussing heat loss, and especially in pediatrics. And in the exam, a lot of questions on temperature loss have come since I've been examining. So I really encourage you to read on all the mechanisms for heat loss. And then, for example, moving on, if we put a laryngeal mask in the autoclave, then, well, it hits the laryngeal mask and the cuff expands and expands, and then it can explode. So there are certain kinds of laryngeal masks that you can put in the autoclave because they are made of a more resistant material that it won't explode, but there are some that you cannot put. And then we have Gay-Lussac's law, which states that at a constant volume, the absolute pressure of a mass of gas, so this is my constant volume here, they have exactly the same volume, the absolute pressure of a mass of gas varies directly with the absolute temperature. So this is my pressure at X temperature, and I heat it up, and then all the molecules will start going pin, 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 and they gain energy. And by gaining energy, they move faster and stronger, thus creating more pressure within the system. So Gay-Lussac says if you heat something, the molecules will have more energy and cause more pressure. And this is, for example, how pressure cookers work. So other problem we can have is that at high temperatures, the pressure in medical cylinders can rise and cause explosions. Your oxygen cylinder, take it from Sweden, where I'm here, that is, freezing more than half of the year, and take it to the Caribbean, and then there is a risk of explosion. And that's why there is something called the filling ratio. And it is how much you can fill your cylinder depending if you're in cold countries versus in tropical countries. And this is a safety feature to prevent explosions in case of rise in temperature. Okay, but now we have discussed Boyle's law, Charles' law. We are also going to talk about Avogadro in a moment, and we're going to arrive to something called the ideal gas law. And this is a unified way of learning all the laws. It's P times V equals nRT. So pressure times volume equals N is the number of moles, R is the gas constant for any given mass gas, and T is the temperature. And memorize this, okay? It's in red, it's in big colors, and you need to memorize it. It's just equally as important as the Hagen-Poiseuille equation. It has come a lot in the exam, because then can make all the modifications to see if you actually know which one increases if the other decreases, and play with the equation. So, of course, it is important to know which one is Charles, which one is Boyle's, and which one is Gay-Lussac's, but this law joins all of them. So really memorize it. You'll for sure will be able to answer one extra question in the exam. So we're going to go through a lot of little different concepts, and at the end it will make sense. So there's something called the standard temperature and pressure, the STP. And this is fully arbitrary. A group of researchers said, okay, we need to work with something. We need something called the STP. Okay, we're going to say that the standard temperature is 0 degrees Celsius or 273 Kelvin, and the standard pressure is 1 atmosphere. So whatever I have at this combination is STP. So STP is standard temperature at 0 degrees Celsius and standard pressure at 1 atmosphere. The Avogadro hypothesis states that equal volume of gases at the same temperature and pressure contain equal number of molecules. So we'll read this again because it's very important. It says that equal volume of gases. So I have two different gases, but I have the same volume at the same temperature and at the same pressure. They will contain an equal number of molecules. But because of the molecular weight of gases, they have different masses. The mass will vary. So it's difficult to say, give me 10 grams of oxygen versus 10 grams of carbon, because they have different molecular weights. But if I give you the same volume at the same pressure, at the same temperature, then I'm giving you the same number of molecules. Some might weigh more, it's heavier, but it's the same number. So a mole is the quantity of a substance containing the same number of particles as there are atoms in 0.012 kilograms of carbon-12. So 1 mole is 6 times 10 to the 23 atoms. It might weigh more, but it's the same amount. So 1 mole of any gas at STP, so at the same temperature, at the same pressure, 0 degrees Celsius, 1 atmosphere, occupies 22.4 liters. It might weigh more because, for example, hydrogen, it will weigh 2 grams per mole. Oxygen, 32, and CO2, 44. But 1 mole of them, they will occupy 22.4 liters, the same number of moles. Dalton's law of partial pressure states that the total pressure of a mixture of gases equals the sum of the partial pressures. So if you have oxygen plus nitrogen, gives you more or less what we have in the air. And look that the pressures are added, not multiplied. And this is a common mistake people do in the European exam, or we're studying physics for anesthesia. The pressures are not multiplied, they're just added. We have Dalton's law of partial pressure that, you add them, you don't multiply them. So air, 101 kilopascals, we go back to the beginning of the lecture, or 14.69 psi, pressure equivalence, and this is the sum of the partial pressures in the mixture. Then we're going to move into critical temperature. Everything has to do with the standard temperature and pressure and the Avogadro number and the mole. So the critical temperature is the temperature above which a substance cannot be liquefied, no matter how much pressure is applied. So I have my substance, and if I put it above the critical temperature, it doesn't matter. It cannot, if I put so much pressure, I cannot turn it into a liquid, because due to the temperature being above the critical temperature, the molecules have too much energy to be turned into a liquid. So critical temperature, the temperature above which the substance cannot be liquefied, no matter how much pressure. And there are critical temperatures for oxygen, for CO2, and for N2O. I don't think it's crucial to memorize them, but they have actually come before in the exam. And above the critical temperature, the substance can only exist as a gas. But below the critical temperature, if I apply enough amount of pressure, I can actually turn it into a vapor or a liquid. Then we have critical pressure. Is the pressure needed to liquefy the gas if it is at the critical temperature? So I don't have it above or below. I have that gas just at the critical temperature. And then there's something called the critical pressure, which is how much pressure I need to apply to that substance to turn it into a liquid. And for example, for oxygen is 50 bar or 50 atmospheres, for CO2 is 73, and for N2O is 72. And again, these have come previously in the exam, the numbers, but what has come much more often is the concept. So they can ask you, critical pressure is the pressure needed to liquefy a gas above its critical temperature, and it's not above, it is exactly at the critical temperature. So that would be false. And then we have something called the critical volume. The critical volume is occupied by 1 mole of gas at the critical temperature and the critical pressure. So I have my gas that just at the critical temperature heating, at the critical pressure compressing, and that volume, how much is occupied, that's the critical volume. Okay, there are a lot of concepts, but then there is another concept called the triple point of water. The triple point of a substance is the temperature and pressure at which it coexists in the 3 phases. So water can be a gas, a liquid, and a solid at the same time and coexist in thermodynamic equilibrium. The triple point of water is 0.01 degrees and 0.006 atmospheres. If you put water at this temperature and at this pressure, water can be in equilibrium in all 3 phases. Then we're going to move into solubility and Henry's law. At a constant temperature, the amount of a given gas that dissolves in a given type and volume of liquid is directly proportional to the partial pressure of that gas. Different gases have different solubilities. More molecules are soluble at higher pressure because I'm pushing them to dilute. And solubility decreases at higher temperatures because if the molecules have more energy, they don't want to dissolve. So in the exam, a lot of questions have been asked, especially in part 1, about if I have increased temperature, I can increase the solubility, which is false. Higher temperature gives me less solubility, but higher pressure does give me high solubility. And an application of this is diving. So the solubility of gases increase at depth in accordance with Henry's law. So the body tissues take more gas because they're at a higher pressure. They are more soluble, so they dissolve in our tissues, and they become saturated for that specific depth, so that specific pressure. But when ascending, the diver is decompressed, and the solubility of the gases dissolved in the tissues decreases. So if the supersaturation is too great, so if everything is just dissolved and the diver goes up too fast and there is no time for that gas to leave those tissues, bubbles may form and grow because there is less pressure applied to them, so they grow. And the presence of these bubbles can cause blockages in capillaries or also affect the solid tissues. So to avoid this injury, the diver must ascend slowly enough that the excess dissolved gas is carried by the blood and released into the lungs slowly. And this has come both in the part 1 and in the part 2. In the part 1, as you know, true and false, diver, if it ascends too fast or too slow, and it's because of the increased solubility. So it's more on the basic science. And in the part 2, it usually comes as a clinical question, you know. You have received a patient to the hospital that was diving and it came up too fast, it ascended too fast, and then it arrives to the emergency unit. You take care of the patient. How would you treat it? So the first thing how you need to answer this question is like, what is diver's disease? Then you start by telling them about Henry's law and the saturation and the pressures, and then you tell them the clinical manifestations because, you know, the patient has blockages in the capillaries. And then you tell them how you treat it, which is put the patient in the hyperbaric chamber until it can compensate. So you put it in the same conditions you had before. So the bubbles decrease in size and then start dissolving, and then you remove the pressure progressively so that it can go through the lungs to the exterior. So this is very, very important to remember for the exam. Then we're going to just talk about a moment about partition coefficients, which is the ratio of amount of a substance present in one phase compared to another phase. And therefore, a measure of the difference in solubility of the substance in these two phases. So how much dissolves in blood versus in oil, for example. And tension is often used to indicate partial pressure for gases in the solution, but beware, it's not surface tension. And it could be applied to two different liquids. For example, you have the solubility of anesthetic gas in blood versus in gas or oil gas. So blood gas is used to describe the solubility of inhaled anesthetics in blood. The more soluble the anesthetic is in blood, the more it binds to plasma proteins and the higher blood gas partition coefficient. So if the gas is very soluble, it dilutes in the blood, it binds to plasma proteins, and then it's useless. So if you have a gas that has a high blood gas partition coefficient, which means that it's more soluble, it is inversely related to the induction rate. Because once it binds to plasma proteins, it's useless for the aim we have. It won't have an effect on the brain. So then, the higher the blood gas partition coefficient, the slowest the induction rate. For example, desflurane has a very small blood gas partition coefficient. So you could think, oh, desflurane, this is the best. I can do an induction anesthesia with desflurane because it will go super fast. And yes, in theory, but sadly, desflurane has adverse effects that prevent you from doing an induction anesthesia with desflurane because it is irritant to the airway and it can give you tachycardia and tachyarrhythmias. So in theory, if we just look at the blood gas partition coefficient, it would be very fast, but there are other factors that affect its use. And this that I've just told you comes a lot in the exam. So the poorly soluble, they arrive to the brain more. Because they're poorly soluble in blood, they don't bind to the plasma proteins, and they actually can arrive to the brain to have an effect. And the highly solubles, they just stay attached to the plasma proteins. So this table that includes the comparative solubilities of inhaled anesthetics, the ones that I've marked here with these boxes are the ones that I think are very, very important to memorize for the exam. Halothane is of very high historical interest for anesthesia, and it also has the highest blood gas partition coefficient. So it's very nice to compare an induction analgesia with halothane versus sevoflurane. And in the exam, for example, a question that I can imagine for part 2, it's compared to anesthetic gases. Okay, so I would go for sevoflurane and halothane because they have very different profiles. Both can be used to do inductions, but they behave very differently because of the blood gas partition coefficient. But of course, so you can use that comparison and get your 2 points for that question. Or you can compare sevoflurane and desflurane and also discuss the blood gas partition coefficient. You can also talk about these ones, the fat blood partition coefficient, which tell us why the emergence of anesthesia from desflurane is faster. And then you can tell them exactly why I explained before why it's not good to do induction anesthesia. So these are good examples if you get this question in the part 2. And in part 1, everything can be asked true or false. So the ones that I've marked in the black boxes are the ones that most commonly come. Then we're going to talk about diffusion, which is the movement of a substance from an area of high concentration to one of low concentration due to spontaneous random movement of its particles. So just listen to what I said. Spontaneous random movement. If it's spontaneous random movement, there is no energy required. So diffusion is a passive process driven by gradient. No energy required. It's in red. It has come in the exam many times before. So just remember, diffusion, passive, no energy required. Then there's other things besides diffusion, but we have Fick's law. And Fick's law, it's super important for anesthesia. Fick's law dictates the rate of diffusion. So you have your concentration gradient. So from high concentration to low concentration. Then you have your surface area, the diffusion coefficient for any given gas, and the membrane thickness. And then this is super important, because if you're having a patient that has idiopathic fibrosis of the lungs, then you have the membrane thickness will be increased. So if I increase the thickness, I decrease the diffusion or the surface area. So that's why it's not the same to do anesthesia for a 500-gram premature baby than a full-grown adult, because the surface area of the lung is affected. And if I have a lower surface area, I have lower rate of diffusion. And then there's the factor of diffusion coefficient. And this is very important for the exam, because oxygen and CO2 have very, very, very different diffusion coefficient that you're going to remember. So the rate of diffusion of a substance across a membrane is proportional to the solubility. More solubility, more diffusion. Proportional to the concentration gradient. Higher gradient, higher diffusion. Proportional to the area. Higher area, higher diffusion. Inversely proportional to the tissue thickness. The thicker, the less diffusion. And inversely proportional to the square root of the molecular weight. So bigger gases, they don't like to diffuse. And for example, CO2 is more soluble than O2. And N2O is more soluble than N2. And this is very, very important to remember for the exam. Because, for example, in a patient that is, for example, the asthma patients with the thinner airways, and then you need to explain in the two phases of the asthmatic crisis, at the beginning and at the end, in which one you have retention on CO2. Do you have it at the beginning or do you have it at the end? And it's related to the solubilities and how much the patient is hyperventilating. Then we're just going to take a moment and go through this slide, because questions have come a lot about osmosis. I actually got it in my exam. They asked me about Raoult's law. So this has come in the exam many times before, so we're just going to go through it. An osmole is the amount of particles equal to an Avogadro number. So we already know that an osmole is it's a mole. The osmolarity is the amount of osmotically active particles per liter of solution. And the osmolality is per kilo of solvent. So you need to remember these two, because they can be asked in the true or false part in part 1. Then you have osmotic pressure, which is the pressure exerted within a sealed system of solution in response to the presence of osmotically active particles on one side of a semi-permeable membrane. So you have a closed circuit, you put your permanent semi-permeable membrane in the middle, and then you have pressure from one side to go to the other. 1 osmole of solute exerts a pressure of 1 atmosphere or 101 kilopascals when dissolved in 22.4 liters of water, of solvent at 0 degrees. And 0 degrees and 1 atmosphere is standard temperature and pressure. Raoult's law states that when a solute is added, the chemical potential of the solvent molecules is lowered. And this manifests as lowering of the vapor pressure and freezing point, and raising the osmotic pressure and the boiling point. And this is this is how the osmometer works, and it's the device for measuring the osmolality of a solution, which either uses the reduction of vapor pressure or the depression of the freezing point phenomena, which is the Raoult's law. So in the exam, they ask you, the osmometer is based on Henrik's law. Well, no, that's false. It's Raoult's law. And it uses the increasing of the freezing point phenomena. No, it's the depression of the freezing point phenomena. And I promise you, we're almost at the end of the lecture, and we're just going to talk a moment about the Wheatstone bridge. the Wisdom bridge is very important because when we measure something from the body, we don't get electrical numbers. We don't get a number in the monitor from the body. It needs to go some sort of transition. We usually get pressure, and then that is converted into a number in our monitor. So the Wisdom bridge is an electrical circuit designed to measure an unknown resistance by balancing two limbs of a bridge circuit. And variations of the Wisdom bridge can be used to measure capacitance, inductance, impedance. It's used everything you measure from the body and have a number in your monitor uses a Wisdom bridge. So if I know my resistance 1, and I know my resistance 2, and I know my resistance A is a variable resistance, I can know my resistance X, because this divided by this, it has to equal this divided by this when the energy passes the system. So what is happening is that variable resistance is testing all the numbers all the time, and then pling, the energy passes. So it found the right number to keep the equations balanced. So that's why using the variable resistance, we can find the missing resistance to complete the circuit, and then you get electricity passing. So that's how you find the number. So that's how the Wisdom bridge works. And the Wisdom bridge has come in the exam several times, and it doesn't need to be asked directly. Well, tell me about the Wisdom bridge. But the question can be, for example, in part 2, I'm imagining a question that they ask you, well, tell me, how do you measure invasive arterial blood pressure? This is an excellent basic science question for the first table in part 2. And then you need to tell them, well, I put it here. I need to put these sizes because if I put too big or too low, I can get the overdamping, the underdamping, and you tell them all the phenomena we have discussed in the anesthetic equipment lecture. And then you need to tell them, and I also will tell you about the Wisdom bridge, which is used to find the unknown resistance in the system, so that I know exactly how to get a value from a mechanical impulse and get it into a number in my monitor. Because if you just tell them, I put the line and this and that, you will get to 1 point, 1.5, but you want your 2 points. So then you need to tell them this, and this will definitely move you to your 2 points. So I hope that this is your face when you take your exam, you get your results, and you are got the passing marks. Thank you very much for listening to my lecture, and if you have any questions, we'll take them during the discussion.